In recent years, mounting evidence has shown that effective oral health practices are not just about keeping teeth clean, they play a vital role in preventing serious health conditions. As 2025 is here, understanding the deadly link between oral health and systemic diseases like heart disease, diabetes, and dementia has become more urgent than ever. Surprisingly, while 95% of people report brushing daily, only a fraction maintain the flossing and gum health practices needed to protect against these broader health risks. This highlights the critical role of preventative education and actionable insights in improving oral health outcomes. Brynn Snyder is our guest today on the podcast, and she's the co-founder of Slate, which is the leading charge in this space. Slate is an award-winning health tech company, developed the first ever electric flosser of its kind, and Brynn is a mother of 5 with a background in product design, and she's also the co-founder of Slate with her husband, who's a dentist, and they prioritize accessible oral health care for health-conscious families. And I'm very grateful for both of them because they gave me some tips on things that really helped me in some recent dental stuff we'll talk about on the podcast here. But in just 2 years, this company scaled from a Kickstarter campaign to a 7-figure business, which is like amazing. Mom, all the things, right? I love reading this bio. I'm getting goosebumps and a little sweaty here. She earned features in top publications like Men's Health, Goop, Allure, as well as appearances on podcasts like How I Built This and Ask the Dentist, and now Self Love and Sweat. Brynn, thank you for being here. I'm so happy to chat with you today and talk about our oral health and just the fact that you're such a boss mom. So thank you for being here.
Thank you for having me. I am so passionate about oral health. You wouldn't think that someone could be this passionate, but the more I learn, the more I care. And I think as a mom of 5, it just made me realize like dental bills are expensive, and I would rather focus on preventative health than reactionary.
Let's talk about flossing versus brushing. Why do we think we have to brush, and why is flossing like the lost art that's going to help us in so many other ways outside of just like what it looks like when we smile?
Yeah, so typically I would say if you ask someone what's more important, brushing or flossing, most dental professionals would say flossing. And the reason is because of your gum health. So bacteria sits in your gums. And so if you're flossing, you're going to be disrupting that bacteria. Now, a lot of people brush, but they're not even brushing their gums. And so if you don't, I think the hard thing is when I was younger, I thought brushing your teeth means you get recession, like your gums. That is the case if you're doing too hard or
Recession
using
of the
hard
gums, like
bristles.
when it starts to like move up and okay, yeah, I
Yeah.
know what that means.
But what we've learned is like that you cannot not brush your gums or you're going to have bacteria just sitting in it. And so flossing really is the way to disrupt the bacteria. If you brush, you're missing more than 40% of your tooth surface and you're missing a lot of the gums. And so what we learned in the dental office is that flossing is very technique sensitive. And so that's why we invented our product. What we did was we invented these little gum sweeps to go into the area where your gums and teeth touch, because your toothbrush just goes right over that. And if you're not flossing correctly, if you're just going in and out, you're not getting the gums either. So water flossing is a way some people do that, but then if you don't string floss, you're missing the cavity part. So we wanted to make it so you didn't need 2 tools. You didn't need string floss and a water flosser, but that you just needed 1 tool.
Nailed it.
Something that always blows everyone's mind is if you have gum disease for more than 5 years, you're 70% more likely to have dementia.
Yeah. And I've been, I've been researching a lot on this topic. So then, of course, when I go on like Instagram or other social media sites, my populated page is a lot of interviews about oral health and all these different things. And there was a guy that was a doctor that worked. I want to say he definitely had a dentistry and doctor, kind of background scenario. But what he was saying is like he had never met a cancer patient that didn't have something going on with their oral health, like with their oral microbiome. Something was off, or, bacteria, like you mentioned, not
Yeah, a
addressing
quote that
cavities.
I was like, I love from Dr. Mark Bernheim. He is Ask the Dentist. He says, you can't be healthy without a healthy mouth. And I think people they don't think about what they're putting in their mouth. Like Monsters, wine, like pop, the pH of those, like people don't think about the pH of their mouth. And when the pH is lower than 7, the bacteria are really happy and they eat and then they put acid all over your teeth. So we can make
Those are
it
the
easy.
sugar bugs, right? Like
Yes,
the sugar
like the
bugs,
sugar bugs
the
exist. So
pH disruption. That's what it reminds me of, right? Those are
yeah,
sugar bugs.
exactly. So what I always tell people is like, if you're going to drink pop, don't drink it all day long. Drink it in 30 minutes because your mouth is so cool. The saliva in 30 minutes will go back to a 7. So your mouth is always trying to go to a 7 pH. If you drink your pop, it will have dropped to a 3 if you're drinking Coke. So it's going to take 30 minutes to get back to a 7. But if you drink pop all day long, your mouth stayed at a 3 the whole day. So, or if you're drinking wine, it's not like you can't do those things. It's just like know what you're doing. If you have wine, eat cheese, then you can help it go to a 7 faster.
I didn't know that. So it's more than just like when you go wine tasting to have a nice combo, it's actually helping the pH of your mouth. That's
I think
so
the reason it's a nice combo is because it's like an acidic thing and an alkaline thing go together, and it makes it feel great.
good. Yeah, and I think I shared this with you when we first had our little chat off recording, but my cousin was a dental assistant for a long time and I asked her like what's the best thing I can do for my oral health, and she's like floss, hands down. And she also mentioned too about how you said if you're flossing and you're going just in and out, that's why you go in and you wiggle and move and like create. And I know that your tool does all of that. And I also yeah, I know that when I go to the dentist, they'll ask, like, when you floss, does it bleed? Right? Is the bleeding something we don't want to see? Is that an indicator that we haven't been flossing regularly?
Yes. So
What's
because some people are on video, I'm going to show you really fast how to floss correctly. And then I also,
I love it.
so
Yes.
it needs to be what's called the C shape, or with our product, you need to make sure the gum sweeps are touching your gums. So if you're using a floss pick or floss, you want to wrap the tooth of your gums. So,
Brynn is flossing on the podcast right now. This is a first. Yeah. Okay, cool.
so
And
did
you're
you see how you're going to go up? And then here, the cool thing about our product is these gum sweeps have sonic vibrations. So they actually, you can just go in and go side to side. And so these are going to stimulate the gums. And it's just, your gums need to be stimulated so the bacteria gets broken up. And just like a manual toothbrush is good, but not as effective as an electric toothbrush, string floss is great if you use perfect technique, but our product is better at stimulating the gums. So we're
that's like
really
a little
excited
gum
just to help
massage.
people not be worried and to go to the dentist with confidence.
Yeah, because it's like you go there and you feel like they're going to give you a floss more, or yeah, you got a cavity here, we got to take care of this, right? And that preventative piece is huge. And it definitely started for me from a like aesthetic perspective. So growing up as a kid, I had a really crooked teeth and had to have braces and expanders and teeth moved and all the things. And I just remember afterwards being like, oh, I love this beautiful white smile and just, and I had, it's beyond what it looks like because I, of course, had issues and I had this root canal that I recently had removed and all of that. So, yes, it's like the whiteness and the smile, but it's way more than that. Like you said, all those, yeah, side effects are like, yeah, secondary diseases and different things. And it's like we put band-aids on things, but not thinking to go to the root, which is sometimes what's going on in the mouth. And in a lot of times,
Well,
what's
and I
going
always
on
find
in
it
the
interesting.
mouth.
Like, we're all willing to spend a few minutes a day washing our face. Like, just spend a minute, or like you can do this in 30 seconds if you really want to go that fast. But once you've disrupted all the plaque and bacteria from your gums, it's now probably on your tongue. And so we always recommend the last step of your dental hygiene to use a tongue scraper. So ours has 2 rows to lift and rake the hairs of the tongue because your tongue has hairs on it, which is crazy. And then the last one's to squeegee it off. So I like this because it feels very satisfying.
I love raking my tongue and scraping my tongue. And people don't think of that too. There was this one woman that I follow or saw on social media, And she was, really, much older, I think in like her 70s, 80s. And she had really great teeth and a lot of things. And she said that her secret, right, her like grandma recipe, if you will, was brushing her gums. So like coming here and brushing that inside of her gum tissue, because she's like, that part touches your teeth too. And
But
so I
totally
remember